Okay, I think we're going to get started. So thank you all again for joining. My name is Ryan Hans. I'm a designer researcher leading the design and research on the project we're going to be talking about today here at Nava. Um, as you're listening to our presentation today, feel free to type your questions into Zoom's Q&A feature. We'll aim to hold some time at the end of the presentation to answer questions that have come up. And if there are ones that we can answer in chat, we might be doing that along the way. I'll also say this is our fourth demo day for this work, and you can find recordings of our previous demo days on our website, which we will be sharing at the end, or one of my fellow teammates might share the link while we're talking. So you can hear about different topics, see more demos of the chatbot we're talking about today, and we'll continue to share out our work as we go forward. So I'm going to dive into our topic today, helping the helpers evaluating a generative AI-powered assistive chatbot for caseworkers. Here we have a quick overview of the topics we're going to cover today. We'll give a quick overview of the project, the chatbot itself, and the process we went through to evaluate it. We'll go over our specific work evaluating the accuracy of the chatbot with caseworkers. We'll go over our pilot in the real world in LA County. We have Jason to talk about the caseworker perspective, closing thoughts, and then some time for Q&A. So for who you'll be hearing from today, we have myself. Again, I'm a design lead here at Nava. We have my teammate, Michael Chen, partnerships and evaluation lead. We have Jill Bauman, CEO and co-founder, Imagine LA's Benefit Navigator, soon to be Amplify. We have Jason Jablonski, a community health worker at Cedars-Sinai Health System. And we have Eric Gianella, an associate research professor at Georgetown University. So a little bit about Nava Labs. We are a more recent branch of Nava's overall work, and we focus on incubating new products, practices, and policy ideas, building evidence, and cultivating partnerships to advocate for change for those new approaches. Our labs group is currently leading Nava's responsible AI research, which we'll be hearing about today. So I'll give a quick grounding in the scope and goals of our work in this space. We are researching, prototyping, and testing generative AI-powered solutions for caseworkers, call center specialists. The role could expand to include people at libraries or anyone helping people find and navigate benefits. Because as many of us know, navigating, finding, enrolling, keeping up to date with all of those health and human services benefits is challenging. We believe generative AI may be able to alleviate some of the burden navigating these services. So who are we doing this with? We do this with many different partners, including philanthropic partners, Georgetown University Better Government Lab for evaluation work. We implement with partners at nonprofits and government agencies, and of course, beneficiaries, members of the public who are actually navigating these services. While we're doing this work, we take a phased approach. Like any work in the space, always start with discovery, try to understand what are people's real needs, experiences, what are they actually aiming to do. And then once we have that grounding, we do quick experiments that we call proof of concepts, just to get an overall sense of what might generative AI do in the space. Is it overall seeming valuable? Then we move on to focus prototyping, where we choose one of those concepts and really focus, build it out more further, test it to see if it's appropriate and acceptable to staff and to public. We pilot, we deploy in the real world to staff, users, and we evaluate the outcomes, which you'll be hearing about today. And through all of this, we do it all in cycles, testing, evaluating, and iterating as we go. We're talking about the assistive chatbot specifically today, which aims to explain program rules in plain language to staff. But we also have a slate of other tools, and they're in varying stages from those proof of concepts all the way to about to be piloted. And more to come on all of these. Again, you can find more information on our website. But today we're focused on our assistive chatbot tool. So what is that? At a high level, it's designed to be an interaction that suits the caseworker need better than a ChatGPT. So it retrieves program rules from vetted sources only, including the benefit navigator's curated knowledge source, policy manuals about different programs. It provides plain language about those programs, direct citations that can't be changed by the LLM, can translate those answers to different languages, and has guardrails to prevent hallucinations, make sure it's only answering about the scope of knowledge it has. So to kind of ground us in the staff experience, as staff are new, especially, they might have a lot of questions themselves. Programs use a lot of acronyms. I'm like, what do those letters mean? Then I look up what they mean, and I'm like, okay, next time I'll be able to remember. So this is just about acronyms, but you can imagine this applying to everything from what are the programs out there, what do they support, what are the eligibility rules, et cetera, et cetera. So beyond just giving it to people and talking to them to hear how it's going, we have a lot of evaluation processes to see if it's really making meaningful difference for people. So I'll give a quick overview and then I'll pass it off to other panelists to go into details. So when we think about evaluation, we break it down into different questions. Firstly, accuracy. Does the chatbot help caseworkers make accurate decisions and improve the quality of information they share with clients? Appropriateness. Does the chatbot enhance caseworkers' ability to help clients access the full breadth of benefits for which they may be eligible? Administrative burden. So does the chatbot reduce obstacles faced by caseworkers when assisting clients with benefit navigation? Acceptability. Are caseworkers comfortable using the chatbot? To what extent do they prefer using the chatbot over other tools like Google or no tools at all? And accessibility. So to what extent does the chatbot allow caseworkers with different abilities and backgrounds to engage with its capabilities and to transfer that knowledge to the clients they're working with? So to dive into those questions, we took a three-pronged approach, which you'll hear about each of these. We have a randomized offline experiment. We piloted in a real-world setting in partnership with Imagine LA's Benefit Navigator. And we have feedback from caseworkers who were in the pilot and also our advisory council, which Jason and I will be talking a little bit about later. So I will now pass it over to Eric to go into the randomized experiment.
Hi, everyone. So this was work that has been supported by the NSF, and it's in collaboration with information science colleagues at Cornell who study algorithmic fairness, and a postdoc at Better Government Lab, and Michael Chen from Nava. Next slide, please. So the specific program that is funding this is about the responsible design, development, and deployment of new technologies. And the big picture goal is to find a model or kind of create an example of how to evaluate LLM-based tools in safety net programs to inform adoption and use. And right now, there's a lot of benchmarking being done without involving any humans who would be using the tools. And so the goal here was to make it a little bit more realistic and be giving difficult scenarios to people who are actually involved in the work and, while they're being assisted by the tool. And so the immediate question for this experiment was, can providing caseworkers with Nava's chatbot result in better navigation, which here we largely translate as more accurate navigation? Are they helping people determine whether they are eligible, or are they helping people apply in the right way? Next slide. So our approach, because we wanted this to be a rigorous evaluation where the results would kind of generalize beyond the immediate context of this geographic setting and the current version or state of the art of Nava's chatbot and underlying LLM tools was to use a synthetic controlled setting. So that's why we call it an offline experiment. People are being presented with scenarios outside of their work in which we can compare their performance when they have chatbot support and when they don't. Okay, next slide. So what we did to create the scenarios was we took snap quality control data from FNS and Mathematica. We took the last 5 or 6 years of it, and we looked at what are the errors that are coming up most often in the SNAP benefits journey. And so these are errors that are being made by people and systems on a regular basis. And so if you think about it, it's actually kind of a difficult benchmarking data set because these are errors being made by eligibility workers who are extensively trained on SNAP policy rules. Once we had that, we used LLMs to generate scenarios related to the topics of the errors. And then we asked SNAP quality control auditors from 2 states to select appropriate questions, to revise the questions, and then to give us ground truth answers. As we did this, we also had the kind of most frequently associated circumstances and demographics with those errors. So for instance, household composition, household size, demographics in terms of like age, disability, gender. And so we knew kind of what was most common. And we asked the SNAP auditors to tell us, would these answers change if we changed some of those circumstances or demographics? For instance, if somebody was 50 years old versus 65 years old. For a subset of these questions, we generated correct and incorrect suggestions. So we wanted to be able to assess how people reacted to helpful advice, helpful suggestions, and unhelpful suggestions. And then we had those themselves reviewed by the quality control auditors. Next slide. So the setup for the experiment was that we randomly assigned 125 caseworkers to see the intervention to get chatbot suggestions alongside these scenarios. And others, and within that, about like 30 got assigned to the control group in which they saw no chatbot. And so we used the control group to kind of get a sense of, in general, if people are being presented with these difficult scenarios, what accuracy would they have? So, and what we did was we created sets of suggestions that these caseworkers would see that varied in overall accuracy from 55% to 100%, so that we could examine what happens if a vendor came in and implemented a really bad chatbot and about half the answers that people are seeing are incorrect. And what happens if this technology keeps improving, you spend more time tweaking it, improving underlying the databases that it's pulling from, and you get close to 100%, how would people respond to a chatbot that accurate? For instance, would they start to trust it too much and override their judgment when they know better? Next slide, please. So this is what it looked like. This was implemented in Qualtrics, but the circumstances and demographics that I described earlier that the quality control auditors would review and tell us, would this affect the answers to a question? Those are in the client attributes box at the top. So you could imagine, having a legal disability, will change people's eligibility for something. In this case, the program was always CalFresh. And even though the tool itself is for a much wider range of programs, and the caseworkers are helping people navigate a much wider range of programs. So the questions were multiple choice questions, kind of like the one you see below. And then the intervention group would see this, additional suggestion on the right. Yeah, let's go next slide. Okay, so overall what we found was that first, this set of questions was really hard. The average score in the control group was 52%. That the suggestions made a really big difference. So if you look at the chatbot that people saw that were correct 100% of the time, or above 90%, basically we were seeing 25-point average increases for those individuals. So going from 52% to 77%. To get a sense of what the chart on the right means, you have to keep in mind that we carefully selected, we had to generate a lot of suggestions to get incorrect suggestions that actually made sense and didn't also point you to the correct answer. So we had to carefully select these incorrect answers. And this was for the broader research goal of assessing risks and what happens if an implementation goes badly. How would people respond to that? And so using those questions, we found that you could definitely hurt performance. People were already doing not so well on the hard questions, so you could only hurt performance a little bit there. But the surprising thing was that people really trusted the chatbot when they shouldn't have on the easy questions. And so that hurt performance quite a bit. So that's a helpful finding and a caution for people thinking about adopting these tools, that it's important to test them and benchmark them ahead of time. And one other interesting pattern here, or maybe expected pattern, is that the chatbot helps people more with difficult questions. And one thing that we saw was also that overall, the chatbot helped people who were less experienced, who had 3 or fewer years of experience than people who had more experience, which also makes sense. Next slide, please. So yeah, for those who are curious, what does this mean in terms of Nava's chatbot performance? How would it by itself have helped people in this scenario? It would have led to a 21-point or 42% relative increase in accuracy if everyone was just seeing the Nava chatbot suggestions. Next slide. One of the interesting things that we stumbled on was that people may not have been able to sense when they were seeing a chatbot that was very, very accurate. And so it was good that they had some healthy skepticism in terms of accepting the suggestions, but we saw their use of suggestions start to really plateau, and people's accuracy didn't really go beyond 80%, even if the chatbot was giving them 100% correct answers. And so the next experiment that we're going to do is mimics the Nava interface a bit more, where they provide citations and verbatim excerpts from policy manuals to support the chatbot answer. So our new interface in Qualtrics will show that, and we're going to try to see if we can get some people above 90% accuracy with a very accurate chatbot. And again, we think that this is partly dependent on the population. So there's an important kind of matching problem here of like, what's the chatbot for and who are using it for. Next slide, please. So overall, we estimate that on tasks like this using a kind of representative benchmarking data set um, that we created, the Nava chatbot would have led to an estimated 21-point lift in accuracy. Note that in general, like chatbots could also be pretty harmful. When we simulated inaccurate chatbots, we found really large decreases in accuracy. And the greatest impact or the greatest lift was for the less experienced workers, also kind of pointing to, potential learning effects or, research on learning and use of these tools. And that there was a plateau around 80%, which is kind of the basis for a new experiment that we're running soon.
All right. Thank you, Eric. Now we're going to go to Michael for the real world pilot.
Hi, everybody. Thanks so much, Eric, for sharing, walking us through the offline experiment. A lot of exciting findings there. I'm Michael. I help support the evaluation function here on the Nava Labs team, and really excited to finally get to delve into some of these real-world pilot evals and lessons learned with you. So buckle up. Let's go. So to give you a little bit of context before we dive into the details of the evaluation, as Ryan mentioned earlier, our chatbot is embedded in a tool called Benefit Navigator, which was developed by our wonderful partners at Imagine LA, who Jill is here representing the team, and we'll hear from her in a little bit. But to give you a sense of what that looks like, if we could please go to the next slide. Here we've included an animation. Hopefully it will move as I begin talking. Perfect. As you can see here in the background, the chatbot lives inside Benefit Navigator, which you get to using a web browser. And so in this example, I think it should be running on loop. The caseworker is asking the chatbot how to apply for CalFresh benefits. And then you'll see that the chatbot kind of thinks and processes that input and then provides a response. I want to draw your attention as it's scrolling right now that along with the plain text response, it also comes with citations and references to trusted sources. And I think in this particular example, it's actually referencing the original policy manuals that have been published by the LA County DPSS, which is the government agency that administers CalFresh at that jurisdictional level. And so again, as a way to sort of convey accuracy and trust, and if caseworkers wanted to, they could click on those links and take them, which will take them directly into those source documents. They can fact check and get all the nuances. Just to say that much of the design and technical aspects of this chatbot was shared out in our previous session. So if you are interested in any of those details, just feel free to Google. I believe if you look up Nava Labs Demo Day 3, it'll take you to that link and there's the recording. So now we've seen the chatbot, we'll talk about evaluation. So the overarching goal of our eval is really to the Nava Labs Demo Day 3 inches recording on YouTube. Sorry, my Google phone thought I was talking to it. So the overall goal of the eval is to deepen our understanding about how the chatbot affects how the chatbot affected the benefit navigation experience for caseworkers. And as many of you might know, those interactions can be stressful and complicated, can sometimes be high stakes and just challenging. And so we wanted to examine in the context of this study, how does the chatbot get used by caseworkers as they assist benefit-seeking clients? We also wanted to understand if the chatbot might help make benefit navigation a little easier by reducing administrative burden. And finally, we wanted to understand or explore how the chatbot helped to make information about benefit programs more accessible. So let's talk a little bit about methods. I'll tell you about sample study design, data sources, and some measures. So with the help of our wonderful partners at Imagine LA, we recruited a total of 61 caseworkers across 6 human service agencies or organizations. And to help us figure out sort of the effect of the chatbot, we actually were able to use a quasi-experimental design. So roughly half of these 61 caseworkers were assigned to the intervention group, meaning they were given training and coaching and technical assistance, and of course, access to the chatbot. And then the rest of the caseworkers, so the other half, were assigned to the control group, which just meant that they mostly maintained status quo or business as normal or business as usual. And the key distinction here is that caseworkers in the control group have no access to the chatbot. And then we follow both groups forward in time and compare their outcomes at the end of the 14-week period. We were also able to collect data from a couple different sources to, again, to help contextualize and add nuances to our evaluation. In some ways to make meaning of patterns, right? So first we collected data from before and after the chatbot was implemented through caseworker surveys. And so these were short, online self-administered questions that caseworkers could fill out. We also collected product logs, log data in the background. So what this meant is that it gave us visibility into actually what caseworkers were asking the chatbot, so the prompts that they were typing in, as well as what the chatbot told the caseworker as a response, right? It also gave us a chance to identify potential patterns and groupings, which we'll tell you about in a couple slides from now. And of course, consistent with our human-centered design approach, we also interview caseworkers to get a better sense of what they thought of, how they perceived and how they felt, and even ways that they used the chatbot. A quick sort of side note about measures. Part of our eval priority was we wanted to explore if the chatbot could help make benefit navigation a little easier, particularly by reducing the level or amount of administrative burden that caseworkers faced. And so to do this, we worked with Eric, who just presented a couple of minutes ago, and his colleagues at the Better Government Lab to adapt this validated instrument called the Administrative Burden Scale into the caseworker surveys that we were fielding. And so just to give you a sense of what this instrument or what this scale included, here are the four actual questions from the surveys that caseworkers took. So question one is essentially getting at how often do caseworkers encounter these unfamiliar or complex questions? And then questions 2, 3, and 4 line up directly with the three sort of theorized dimensions of administrative burden. So that includes learning cost, compliance cost, and psychological cost, right? So for learning cost, it's, how easy or difficult is it to find answers? For compliance cost, this is about the level of mental effort that's expended to address these unfamiliar questions. And then for psychological cost, we operationalized as sort of like a level of frustration. And just to sort of reference and acknowledge sort of the work that Pamela Hurd and Don Moynihan did have worked on to kind of open this door for us to apply. And certainly just to say that there's other measures on cognitive load and administrative burden out there, but in the context of this eval, we really wanted to see if we could adapt this validated instrument, be able to benchmark against other numbers that are published in the literature, and I think more immediately give us a little bit more context about how the chatbot is affecting caseworkers. Okay, so we've talked about methods. We'll shift gears a little bit and show you some findings and results. So it makes sense to, I think, start looking at usage as an indicator of acceptability, right? So during this 14-week pilot period, we've observed that about 65% of the caseworkers in the intervention group use the chatbot. So that works out to be 20 out of 31. And from these 20 caseworkers, we saw a total of 271 prompts that were sent into the chatbot. So a couple interesting usage patterns to draw your attention to. The first one, as you can see here in the slide, we saw a good deal of usage in the first 5 weeks, but starting in about week six and onwards, there's sort of a downward sloping trend, right? And there's a couple potential explanations for this that we've gathered through caseworker interviews. The first one is I think there's possibly some novelty effect that's working here, right? That initial curiosity and excitement, an opportunity to experiment with something new. But what we see is that after about a month, caseworkers perhaps are returning to what's familiar to them or these established routines and tools. And so the chatbot usage becomes less on the front of mind. The second thing we noticed was that I think the service delivery model at each of these sites, and particularly how the relationship between caseworkers and clients are formed and sustained over time, can also influence chatbot usage. So if you look at the first 5 weeks, right, you'll see a lot of blue, right? A lot of, much of those bars are occupied by shaded blue. And it turns out, as we looked at those usages from that particular site, much of their work is actually about conducting intake, triage, and referrals. So think of these as like brief, one-time touch points, for the way that case workers were interacting with clients. People come in, they get their information, and then figure out where to send them for additional help. Now, if you look at starting in about week 6, we see this low but consistent usage of from yellow bars, right? So these yellow portions of the bar, and it turns out that's actually from a educational setting, right? And so if we think about the way that caseworkers at colleges and universities work, those relationships tend to be more ongoing with perhaps more continuity with multiple interactions over time. And so I think that's another potential explanation for this variation that we observe. And then just to say that there might be some seasonality fluctuation as well. So if you look at I'll call them a minor usage spike in weeks 11 and 13, those actually line up in calendar time with end of the semester, right? So if you think about how, if we operate by an academic calendar, perhaps things are happening at the end of a school year, changes in housing status or changes in financial needs that may trigger that need for additional support through benefit programs. So here we'll look at some measures that kind of give us a sense of how appropriateness work out, right? So how does the chatbot enhance caseworkers' ability to help clients? And to answer this question, we actually systematically went through every prompt and response and tagged them based on what benefit programs were asked about, the type of inquiries that caseworkers were making, and I think most importantly, the underlying client needs that the caseworker was trying to help with. And so I won't read the slide out loud, but just to say that the chatbot was able to answer questions covering 22 distinct benefit programs, with the top 3 being CalFresh, CalWorks, and in-home supportive services. And a chatbot fielded 11 types of inquiries, right? So with the most common being eligibility criteria, somebody asking, what I'm in a family of 4 with this level of income, am I eligible for program X? And then the 14 categories of needs, the most common ones are food, housing, eviction prevention, and then surprisingly, childcare items, diapers actually became a frequently asked item. Okay, we also wanted to give you a sneak or insight into what actual prompts might look like. And so here's just a subset of prompts that we received from caseworkers using it in real world settings. Pointing out a couple interesting examples. If you look at the rectangle colored in red, right? What programs help prevent eviction? What is care? Right? Those are kind of reflect more general inquiry, trying to gather information about specific programs. We can also look at the blue rectangle, right? So what documents do you need for CalFresh? Again, referencing a specific program, it's an inquiry about an application process. And then the yellow rectangle, what is the difference between A and B? That's a little bit more of a sophisticated usage, I think, where the caseworker is asking the chatbot to compare 2 different programs. And then lastly, the purple rectangle, help for domestic violence victims. Interestingly, we also saw a decent amount of prompts that were similar to what we would typically think of as Google search keywords. And so sort of an interesting finding in how caseworkers were using or interacting with the chatbot. Okay, and here is a high-level summary of findings on how the chatbot impacted caseworkers' experience of administrative burden. And just to remind you, the way that we kind of assess this is essentially a pre-post change using short surveys that caseworkers filled out, right? And so when we compared the baseline data before the chatbot was implemented to the endpoint data after the pilot wrapped up 14 weeks later, um, we saw about a 10% decrease in the learning cost score, right? Remember that administrative burden, the way that Moynihan and Hurd theorized is that it breaks down to these three components. So when it comes to learning, what we saw is caseworkers in the chatbot, in the intervention group, experience about a 10% decrease, right? So in some ways, this signals to us that the chatbot might be helping when it comes to information finding or learning about benefit programs and learning about eligibility criteria. Just to note, though, that this difference was not statistically significant. Um, when it comes to the other two components, compliance cost and psychological cost, unfortunately, the signal was really much less clear based on the survey data that we gathered. But what we can say, though, is that qualitatively, when we ask caseworkers about, how does using the chatbot help you with compliance efforts and with how you feel psychologically, they mentioned that the chatbot's provision, like the chatbot's ability to provide quick and accurate information, and often with like step-by-step instructions, actually help to reduce caseworkers' own stress and worries, which in turn sort of improve the level of or the quality of service and interaction that they can share with the clients who are seeking assistance. So overall, potential reduction in learning costs in terms of compliance and psychological cost. I think more work needs to be done to really flush out those effects. And then just to give you some another quote to contextualize what the chatbot is doing to help with time savings and sort of improving the ease or reducing barriers to finding information, right? So this is a caseworker from, I believe, the educational sort of setting that we mentioned earlier. They said, I don't have to go outside of a chatbot to search for answers. Being able to just have that response on hand within seconds for students was amazing. So instead of having to write down all the questions you have and go search for them and read it back to you later, I think the implication here is that, they can use the chatbot and get immediate answers or near immediate answers rather than having to set up, say, for instance, follow-up appointments or email communication or things of that nature. Okay, finally, sharing this finding that's related to accessibility. And the question here is we wanted to know, how readable are the chatbot responses? The way that it's designed is to provide plain language output, right? But we were curious about, just how readable are these responses that are produced by the chatbot. So what we did is we took all 271 responses and essentially applied a standard set of readability tests to them, which in turn give us a suite of estimates, right? That some of which are calibrated to between 0 to 100. Some are calibrated to sort of US grade level. So, what grade level is this writing set at? And some other measures are calibrated at sort of the years of education that's needed to be able to read that text. And so here, this graph, we're showing you essentially the categorization of reading scores based on the Flesch reading ease, which is one of the most common readability index that's used. And we sort of dashed out the three bars at the very bottom there. The takeaway here is that about 3/4 of our chatbot responses are at least somewhat difficult to read, right, or more. So 3/4 of our chatbot responses are somewhat difficult to read, which initially sort of felt, I would say, a little surprising to us. But what's interesting, though, is if we can go to the next slide, please. What we did is we did sort of a quick informal experiment comparing the readability of source materials to our chatbot responses, right? So what we did is we went to the DPSS website, pulled down a couple policy manuals, and ran the text in those policy manuals through the same set of readability metrics, and we wanted to compare. And here's sort of just showing you some, results from two of the tests. So we looked at the flesh reading ease, right? So in the case of that second row, the flesh reading ease, the average score from the original policy manual, remember here we're talking about the source material, that average score was 32.1, right? In the case of this reading ease score, a higher score means it's easier to read, right? And in contrast, the chatbot average reading e-score is 49. So that difference works out to be about 17 points or a 54% improvement in readability. If we look at the Flesch Kincaid, again, this one perhaps is a little bit easier to interpret because this is estimating the US grade level that's required to read a given passage, right? So again, we showed earlier that the chatbot responses require about a 10th grade education to be able to read it. So let's say that's middle of high school. But when we run that same test using text from the CalFresh e-policy manual, that same test yielded a measure of 15, which if you sort of do the math, it ends up being like a junior in college. And so what the way we're interpreting this difference or this percentage change is that the chatbot is improving the accessibility or specifically the readability of information from about a college level to a high school level. It's still not at that plain language suggested recommended level. I think it's like late middle school. And so some opportunities there are still lie ahead of us. And some that come to mind are, you know, you, caseworkers could potentially submit a follow-up prompt and say, hey, thanks for that information. Can you tell it to me at an eighth grade reading level? And I think the other interesting thing that's worth investigating is looking at the potential trade-off between accuracy and readability, right? In an ideal world, we want something to be both highly readable and highly accurate. But our initial exploration seemed to indicate that there might be important trade-offs that we should be careful about. Okay, so those are the high-level headlines from our eval report. Just to say, if that sounds interesting and exciting to you, we are in the process of publishing a full report that's forthcoming later in the fall. I think technically we're still in the summer currently. So, and with that, I will pass to the next presenter.
Great. So many good findings. And like Michael said, we'll be sharing a lot more about the evaluation. And I will just take a moment to mention it's likely we're going to go to the end of our time today, but we will be looking to answer some of the Q&A in chat. And if we don't get to you, we will follow up to respond to your question. So please keep them coming. We definitely want to get to them. And yeah, keep them coming. So now I'm going to have a quick conversation with Jason Jablonski, an advisory council member who helped us. He was one of the first users of the assistive chatbot. He helped us develop it, gave feedback, helped us develop our training session for the pilot, and he is a community health worker at Cedars-Sinai. So Jason, I hope you're ready.
Yes.
We'll just go through a quick set of questions. So firstly, what made you interested in signing up for the advisory board and using the chatbot generally?
Well, as a community health worker, basically what I know is my value and how accessible I am to resources that are effective for patients. So for me, using a tool like this would be something I would use in order to benefit my ability to give information that is correct, accurate, and fast, because I also work in general and total medicine at the hospital, so I don't have a lot of time. Sometimes I have patients that are unhoused, so I have a very small window of time in order to get them resources. And so when it comes to things like reducing obstacles or administrative burden, it helps so much in that so that I can quickly get answers and resources to connect patients with.
Great. And then thinking through, when you're in the clinic or the hospital, how did you interact with the chatbot and then actually use that information with clients
It would
or
be
patients?
normally, because I have to do my write-up and document everything on the patient's chart. So normally when I'm doing that documentation, either before or right after I'm meeting with the patient, I'm gathering all of my information, usually in the morning before I attend rounds, to see which cases are red flagged for me. and then I get more information when I visit the patient. So I'll either go on the chatbot beforehand to get an idea of what I might need and might still have questions on, or afterwards, because I'll still follow up with a patient maybe post-discharge. That's one of the beauties of being a community health worker at the hospital, is that we actually follow post-discharge where none of the other team members do. So then I can go back to my drawing board, go back into the chatbot and dig a little deeper. This is something like the data has shown would have been so awesome when I started. It was particularly good for people just beginning as a CHW, to give them kind of a place to start, some paths to go down. And then for me, in that second round, after meeting with the patient, I'll go dig a little deeper for things that I might just not have, like you were mentioning, cognitive load. There was a much less cognitive load on that burden on me to remember all of this, because I could go to the chatbot and then the sources are another great way of connecting people with resources. Sometimes I'd find out more information in the sources of the chatbot and where they got their answers, because I don't know how to get to those places. Just on its face, it's very opaque in a lot of this. Just like their reading level is higher for a lot of these policy manuals, it's the same thing with understanding how these systems operate. So the chatbot kind of gives me a peek into that world, and then can bring it down to a level that I can understand it at better at.
Right. And you were already talking about sources and citations. Can you say more about how you use them, and maybe if there was a particular one you found or a topic you were using for the sources?
Particularly things surrounding Medicare and DPSS, like things such as CalFresh and general relief specifically. Some patients may have some deeper questions that I might not have answers to. And so I can go to the chatbot and dig a little deeper into this exact policies on how things operate, so I can be more confident in my answers. And that leads me to have more of a feeling of empathy, helpfulness, and understanding. When I know what I'm talking about, it's a lot easier for me to be able to provide that information in a confident way and be empathetic to the patient's needs. And then the other thing would be, just from my own education, I would go in and click on some of these sources in order to understand more, like particularly Medicare, because Medicare is a behemoth of a program. There's a lot of nuances to it. Like we have a situation come up this morning that I used the Navigator for, regarding someone who's receiving a trust, and how that would impact their eligibility to receiving it when they don't have a checking account, but they're still receiving money. And so it's those nuances where we can get caught up. And so I'll have to say to a patient, I need to get back with you on that. I can research with the chatbot. And then I think someone mentioned in the chat too, how the numbers kind of went down. And I could see that in my own experience with the chatbot, where at the beginning I was asking everything. It was like a kid in Willy Wonka's factory. I was going everywhere trying to figure out all these different ways that I can play with it. And then as I continued, I learned more and more, and it didn't rely on it quite as much. And so now it's more just as needed that I'm going back to it. But like I mentioned, for someone who is newer to this, I think it's extremely valuable.
Yeah, a candy shop of program information and citations from policy manuals.
Oh yeah.
Great. All right. So as a last question, thinking future forward for this chatbot, other chatbots in this realm, if you were in charge of developing it further, what would you do to make it even better for yourself and other caseworkers in similar roles?
I think you touched upon the language a bit earlier. I would say, just making the language a bit more accessible as best as it can. And I would say also my magic wand would be just a way to perhaps communicate through the chatbot because basically I'm taking information out of the chatbot, collecting it, then putting it into an email or onto a document to then provide to the patient. If I had a way to directly send this information out of the chatbot to the patient, or present it in a way, because many times I have patients who have no resources, just literally nothing. And so if I have a paper, something. I'm all about flyers. Like any agency I work with, I want flyers because then I could easily give that to a patient, and they can keep that with them to call the number later on or whatever. So this is helpful if I could just find a way to communicate even faster the information I'm finding with patients.
Yeah, making it easier to and all the stuff you're learning to the patients
Help
you're
others
working with.
learn. I mean, I'm
Yeah.
educating patients as well as advocating for them. So I think if I can get more education to them in their hands, they can be better suited to help their own care.
Great. Well, thank you for taking the time to talk with us today. Thank you for taking the time to try this chatbot out and give all the feedback you did. It was really helpful for us as we were developing it.
Thank you for the opportunity. I had a really great time. You're great people to work with. Thank you.
Wonderful. All right, to do some closing thoughts, I will hand over to Jill Bauman from Imagine LA's Benefit Navigator, soon to be Amplify. Over to you, Jill.
Hi, thank you, Ryan, and thank you, Jason. It's a perfect segue into Imagine LA, now Amplify, worked with the Nava team on this project. Jason works for Cedars, which was one of our users, and how the introduction happened. And I love hearing your feedback, Jason's so real. I want to just take a minute, one, to echo Jason's feeling about working with Nava Labs. This was an extraordinarily good, thorough experience. Imagine Lay comes out of working, we are a community-based organization that we for 18 years works alongside families coming out of homelessness and working with them to get not only out of homelessness, but get out of poverty. And through that work, we really learned a lot about how hard it is to navigate the public benefit system. And ultimately, we built the Benefit Navigator as a one-stop shop for trusted information about federal, state, and local benefits. And we've sort of bridged the gap of, really working alongside people that are experiencing poverty and extreme poverty, and really trying to help them. And we've already started along the journey of bringing technology and trusted information to them. And this is going another step, right? And when we went into this work, we were really nervous about trusted information. Like, we had built our information hub, vetted every single word in it, read every policy document, like we really were concerned about trusted information. So thinking about chatbots was scary. And Nava really, really aligned with us, and their methodology in building this was so focused on providing trusted information and trying to make it as plain language as possible. We all want to go further on that, but the difference, the difference between, having this, a Google search or a chat GPT search and what was going on here, if you look at that side by side, it was completely different. I mean, I loved the way that the evaluation sort of surfaced that. That it was really different. So trusted information was key, and always held sacred in this whole process, which gives me hope. And what I also want to say is, what's amazing about Nava Labs is all of this work, and the chatbot, such as it is now in its current form, is open source. So there is an ability to take this and keep going. That's open source, and that's fantastic. I know we piloted it with 6 organizations of we have many users, but we piloted with 6. We have now gone through this process. We are committed to taking the work and doing, and we learned, first of all, I want to just cite a couple of our learnings. One, it was trusted information to the learning, like Jason said. Long Beach Community College, and a lot of those decreases was because they already learned it. You know, like people trusted it and they learned it and they kept going and they built their confidence. It also brought information to them, as opposed so much time is spent going out to information, whether it's in the Benefit Navigator or out into the world, and having it brought to them in a way that they could digest it was huge. And again, I want to reinforce, we know through our case managers and talking, you know, directly to them, our users, that those that were on the younger side then are the newer to case management, they got the most out of it. And so we're committed to trying to help the caseworker industry as a whole, that whole community, feel better and more ease their work. And so the chatbot really helped with that. One of the other lessons learned is people asked about, as Michael said, they asked about all sorts of things, not just public benefits, right, or tax credits, which is the focus of the Benefit Navigator. And that, so even though it literally prompted them to only ask about the public benefits, people, once it saw it was a chatbot, they wanted to ask it anything. So the idea of providing a one-stop shop, you know, a one place for caseworkers to work with their clients and find information, really means that this needs to be expanded even more into trusted local resources for the clients that they're working with. And Amplify and the Benefit Navigator will be working on the chatbot to do just that as we integrate it in long term into our product. So I would encourage any of you that are like looking into really trying to this idea of trusted information and you know, at your fingertips, to, you know, go deeper with the incredible work Nava has done. And if you're also interested in learning more about the Benefit Navigator, which, you know, really helps with application. Another area that's going to be huge with HR1 and the OBBBA is on maintenance of benefits. People are going to have a lot of questions around that going forward. So I encourage you to go and work with this chatbot, work with Nava, and if you would like to explore also it being worked with the larger Benefit Navigator, and the website to learn more about the Benefit Navigator is listed. But thanks again, Nava Labs for choosing us and working with us, because this has really, really been valuable. Thank you.
Thanks so much, Jill. It's been a great process. I think we've all learned a lot on this journey.
Yes,
it's only
indeed.
going to keep going. So I know we're a minute or two over, so just some quick links. All of this work will continue. I believe we'll be sending a recap email with the other links we've shared along the way, the GitHub repo, the Benefit Navigator contact. As we progress further, you can see our work at this link, research and demos from the past, and we also have a newsletter where we'll share kind of smaller, bite-sized updates about what we're up to. So thank you all so much for joining. Like I said, if we didn't get to your question in the chat, we'll follow up with you to give you some more information. And thanks so much for taking the time. I hope you learned something today, and I hope we all build useful things together. So thank you so much, and I hope you all have a great day.